We are the group number 1 and today we will be talking about cardiovascular diseases, specifically rheumatic heart disease. Cardiovascular diseases are conditions that affect the structures or functions of your heart.
Rheumatic heart disease is a cardiac inflammation that has a chronic and progressive damage in the valves of the heart. It may start or may increase the risk if there is an untreated or undertreated streptococcal infection such as strep throat or scarlet fever. It is also caused by rheumatic fever and other inflammatory disease that may lead to the leaking of the heart valves and makes it harder for the heart to function properly. This may occur at any age but usually 5 to 15 years old that may lead to some complications such as heart failure and complication of pregnancy and delivery. Rheumatic heart disease is not contagious. It cannot be transmitted to other people. But some of the infections like strep throat or scarlet fever can be transmitted through respiratory droplets like coughing or sneezing. This disease can be diagnosed by certain tests like blood test, echocardiogram, electrocardiogram, chest x-rays, and cardiac MRI.
Each year, approximately there are 282,000 cases and 233 deaths from rheumatic heart disease. With a total of 15 million cases worldwide, majority of the cases were accounted in developing countries. In 2015, studies showed that the age-standardized prevalence in countries with an endemic pattern was 444 per 100,000, whereas it was 3.4 per 100,000 in countries with a non-endemic pattern.
Modifiable risk factors which are primarily affected by our lifestyle decisions. This includes the following according to American Heart Association. That includes obesity, tobacco use, eating a high-fat, high-sugar diet, sedentary behavior, blood pressure that is too high, blood sugar levels, and the bad cholesterol. Changing these risk factors for better necessitates certain lifestyle changes. This can be daunting at first, but you don't have to do it at once. So divide and conquer instead.
In people under the age of 25, rheumatic heart disease is the most common form of heart disease. It is also the most common heart disease seen in pregnant women in areas where rheumatic fever and rheumatic heart disease are prevalent, causing severe maternal and perinatal morbidity and mortality. Despite being eradicated in many parts of the world, the disease still exists in sub-Saharan Africa, the Middle East, Central and South Asia, the South Pacific, as well as among immigrants and older adults in high-income countries, especially among indigenous peoples.
So now, let's move on to the 5 risk factors that may increase the risk for the rheumatic heart disease. First, the obesity. Second, the diabetes or impaired fasting glycemia. Third, the dyslipidemia. Fourth, the hypertension. And lastly, the microalbuminuria.
Regular washing of hands, covering the mouth while coughing, staying away from sick people, and cleaning the food by thorough washing and cooking are also ways to prevent acquiring of the disease-causing bacteria.
In the case of non-modifiable factors, it cannot be changed but we can find immediate prevention. The early detection of the disease, it can be cured immediately. This is to ensure that the detection of the disease before it can cause further damage. After all, prevention is better than cure.